Welcome back to the Hampton Roads Show, Baby Week here. Whether you're new to parenting or if you've been on the job for years, you know the importance of your pediatrician. Joining us now is Dr. Robert Fink from Pediatric Specialists, a children's medical group practice of CHKD. He's here to talk about SIDS and RSV and how parents can protect their children. I got to admit, Dr. Fink, when we first had our children, I was really freaked out at night when we set our kids down, wondering if we're doing the right thing. And I know that's a big part of it.
It is, and SIDS is probably the scariest and the most dramatically devastating illness that occurred to a family, an event that can occur to a family. It is the sudden, unexplained death of a previously healthy child, and a child goes to sleep healthy and does not wake up.
And is it respiratory? Is it breathing? Because we just don't know what the cause is.
Exactly. We don't know what the cause is, but there are things that parents can do to help prevent the SIDS from occurring, such as making sure that a child sleeps on its back, put the sleep on the back.
Right.
Make sure that there is no cigarette smoking around the baby. That seems to predispose babies to sudden infant death syndrome. Making sure that they don't have a hard, that they do have a hard mattress instead of a soft mattress. No stuffed animals in the bed. No side paddings on the bed. So these are things that are important that will help prevent SIDS in babies.
I can imagine it all starts even prior to baby being born. How important is prenatal care?
Absolutely important, and every parent and every mother should have exceptional prenatal care, making certain that if they can breastfeed, that helps prevent SIDS. Very important.
Let's talk about RSV. Most people have not even heard about that. It's a virus from the respiratory system?
Absolutely. It's a very common respiratory virus that we see. Basically, every child gets infected before the age of 2 years. Older people get it, but when older people get it, like you or I, we're not older, but we're older than the babies, they get cold symptoms. When infants get it, especially, they can wheeze, they can have significant problems, and end up being hospitalized. It is the #1 virus that causes hospitalizations in babies in the country.
And we see it everywhere when people are sneezing, coughing. Those are symptoms of RSV, isn't it?
They are symptoms of RSV, especially in older people.
Right.
Again, in infants, it tends to be wheezing, but it can also be the congestion and coughing.
And what that tells me is it's probably really important to get your immunizations and flu shots. Is that part of the...
It is. We can't prevent against RSV, at least not for regular babies. For premature babies and for babies who have high-risk problems, there is a medication that's like an immunization that can be used. But the immunizations are so important for babies for preventing pertussis, which is a respiratory infection, meningitis, polio, any number of very severe childhood illnesses that we can prevent.
Now, I know you're a big advocate of breastfeeding. Why is that so important for young infants?
Well, it's so important in any number of ways. One is that we know that breastfed infants have better immunity and immunity against respiratory infections and intestinal infections. Breastfed babies have higher IQs, they have fewer allergies, a great way for babies and mothers to bond. So many good advantages of breastfeeding.
Well, Dr. Fink, you've given us a lot of great information this morning. Dr. Fink, Pediatric Specialist, part of a children's medical group, CHKD, locations in Norfolk and Chesapeake. For more information, log on to chkd.org. Dr. Fink, thank you so much for joining us today.
My pleasure. Thank you.